Narcissistic personality disorder, or NPD, is a personality disorder characterized by grandiosity. You may see it in people who have an inflated ego with little regard for others. It's important to note that NPD is a psychiatric condition and is more complex than simply being arrogant. It's distressing for those who have it and to those around them. We hope to shed some light on the condition and signs that a person should seek help. But before we begin, we would like to mention that this video is created for educational purposes only and is not intended to substitute a professional diagnosis. If you suspect that someone or you may have narcissistic personality disorder or any mental health condition, we highly advise you seek help from a qualified mental health professional. Now, let's begin. What is NPD? While much of TV and movies portray narcissism as people who feel like they're better than everyone else, it's usually not just the case. NPD is a personality disorder in which the person feels self-important and craves constant validation. Their feelings of superiority often hint at a deeper problem, as their need for validation often comes from a place of insecurity and instability, rather than genuine self-love, which they may not be aware of. So what causes NPD? While the cause of NPD is unknown, researchers believe that it has to do with a combination of genetic and environmental factors. It's believed that 6% of people have this disorder, and that men have a higher chance of this disorder than women. Some believe that NPD is developed to cope with trauma and feelings of inadequacy. Others believe it may be learned in early childhood from dealing with anything from abuse to excessive pampering. There's even a debate as to how much of the disorder is passed down from parent to child versus from environmental factors that lead to the child acquiring the disorder. What are the signs and symptoms? Feelings of grandiosity, where they feel that they're superior to others, and low empathy are often seen in those with NPD. They don't care much for others except to receive constant validation. People with NPD feel as though they're entitled to whatever they want, which can be dangerous as it can manifest into toxic relationships. They may manipulate others to get what they want. They brag and exaggerate their achievements or feel envious of anyone that outperforms them. But deep down, the person with NPD may be really dealing with their own feelings of inadequacy. How do I know to get help? People with NPD may not seek help for the disorder itself, as they may not know that there's an issue. Usually, people are diagnosed because they seek treatment for other issues, such as depression or addiction. However, people who feel that they may have the condition are urged to reach out for help. NPD and the underlying feelings of inadequacy can be treated. It not only benefits the individual, but also the people around them. What treatment options are available? People diagnosed with narcissistic personality disorder will most likely work with a therapist using psychotherapy methods. Other self-improving activities, such as exercise and hobbies, may be used in conjunction with therapy. It's important to know that treatment is available and that life can be made more manageable.